Hello, Dr. Benjamin Domb here, presenting at the American Academy of Orthopedic Surgeons on the minimum 10-year survivorship and outcomes of arthroscopic treatment of labral tears in young adults. By way of background, previous studies show good midterm outcomes in this population. However, long-term outcomes have been limited in young adults. In this study, data was prospectively collected through the American Hip Institute's registry and was retrospectively reviewed. The patients in this study underwent primary hip arthroscopy between 2008 and 2012 and were aged 19 to 40. All had labral tears, which were treated with debridement, repair, or reconstruction. Preoperative data was collected and minimum 10-year follow-up was achieved. This included patient-reported outcome scores of the modified Harris Hip score, non-arthritic hip score, sports-specific subscale, and visual analog score. We excluded patients with previous hip surgery or conditions, tonus grade greater than 1, hip dysplasia, or workers' compensation status. Ultimately, 241 hips were eligible for analysis. Over 80% had minimum 10-year follow-up. And of these, 63% were female and 37% were male. Mean age was 29 and mean BMI was 24.8. The 10-year survivorship was nearly 92%. 12.9% underwent a secondary arthroscopy during this time at a mean of 36.8 months. So there was significant improvement in all patient-reported outcome metrics from baseline to 10-year follow-up, including the Harris Hip, non-arthritic hip score, sports-specific subscale, and visual analog score. The patients all achieved high rates of MCID for those scores as well, and high rates of pass were achieved for the Harris Hip score. One of the factors which is inherent to long-term follow-up is that we are looking at techniques that were done over 10 years ago. However, they were, for the most part, fairly modern techniques. The majority of the patients had a labral repair for their labral tears. They had femoroacetabular impingement treatment with emphasis on spherical femoroplasties. And for the most part, they had capsular closures as well. These things have all become standard today, where a majority of our patients get a labral repair or reconstruction and all get FAI treatment with an aim toward perfectly spherical femoroplasties. The majority get capsular closures or plications as well. So clearly there's been an evolution of the techniques over the last 10 years, and it's important to acknowledge that the long-term follow-up looks at procedures we were doing over 10 years ago, and our procedures continue to get better and better since then. Nonetheless, even with those techniques from over 10 years ago, we saw a very high survivorship. You can see that here in a Kaplan-Meier survivorship curve. And in conclusion, patients in the young adult category treated with hip arthroscopy for FAI and labral tears had a high survivorship at nearly 92% at over 10 years follow-up, and had significant improvement in their patient-reported outcomes metrics and a high rate of pass patient-acceptable symptomatic state for the modified Harris Hip score. Thank you very much.